Director General, thanks for joining us again here on RegWatch. It's Friday, and it was just Wednesday. We were at Health Canada in Ottawa to talk with Director General Van Loon. James, please tell us what happened on Thursday that has brought you back on our show.
On Thursday morning, the Health Canada released a new consultation report about additional measures that might be taken to reduce the youth access and appeal of vaping products. This is in addition to the notice of intent, which was the principal topic of our conversation on Wednesday, notice of intent from February, which was about further restrictions on promotion of vaping products. This is more about what sorts of measures might be taken to control the youth access and youth appeal to the vaping products themselves, whether that be about flavors or nicotine concentration or the design of the product or the access of young people to stores or online shopping. These are all sort of part of the same continuum, part of the government's ongoing efforts to ensure that we are responding quickly to the alarming data that we have about rapid increases in young people using vaping products.
On Wednesday, James, I got the sense that when we started the interview that there was kind of I'm skeptical of a youth vaping quote-unquote epidemic, and you're not skeptical about that. And I thought maybe that was part of the reason why our interview was unfolding the way it did. How do we bridge that gap?
Well, I think the consultation report that we've just rolled out actually provides quite a lot of detail on the evidence that we have about youth use of vaping products. And that goes back, we talked on Wednesday about the substantial increase that we've seen in the U.S. in youth vaping of about 75% year over year between 2 Septembers ago and last September. And that we don't have any reason to question that a similar phenomenon is going on in Canada. We're hearing from parents and educators and people all across the country about what they're seeing as a rapid increase. On top of that, it's corroborated by previous years' data from our Canadian Student Tobacco, Alcohol and Drug Survey, which between sort of 2015 and 2017 had seen consistent year-over-year increases of about 30%. And then we have actually got access to some additional data coming from David Hammond at University of Waterloo, which I know is not yet publicly, or I don't think is yet publicly available, but that indicates that trend continuing and accelerating into 2018. So that's the data that we're looking at. That's why I think there is an issue with young people taking up vaping, not to mention that I hear about it from my kids at the dinner table.
Right.
That said, a big part of this is about making sure that we do what we need to do to protect young people from inducements on vaping, to ensure that there's still a product here for smokers who want to switch. This is a less harmful product for those who switch completely, and there's good evidence on that as well.
Is vaping a part of the overall plan that Health Canada sees going forward to get you to the goal of reducing the amount of combustible tobacco smoking?
Yeah, that's a great question. Thank you very much for that. And I think it is. The challenge that the government has embraced is to try to get the amount of tobacco use in Canada down under 5% by 2035. We're currently at sort of 15 to 17%, depending on which survey, a large amount of which is smoking, over 90%. And this vaping can provide, for those who switch completely, a less harmful alternative to smoking. And I do think it's part of the deal. In order to get to 5% by 2035, we're going to need all kinds of innovation and all kinds of effort across parents and educators and regulators at all levels. But we also need alternatives for smokers. A lot of people have to quit if we're going to get there.
So on flavors, I'd like to start actually at the end, because I found this hopeful. And in the report, it says, a regulatory approach that would restrict the use of specific flavors, for example, those that are particularly appealing to youth in the manufacture of vaping products, could be considered. However, flavor additives can impart different properties at different concentrations, and there's a wide range of combinations of flavor additives that can create a particular flavor. And then you go on to explain that, and then it says there are a vast number of individual flavoring chemicals and chemical combinations present in e-liquids, and the industry is constantly innovating. And there's a message there, both to people who may agitate for restrictions on flavors in a very strong way, and those that rely on flavors because it's an integral part of vaping as a tool for harm reduction for them. Am I reading that correct, that flavors may not be so easy to regulate because they're complex and they're also a part of the innovation?
Yeah, we already have some rules that apply to flavors, but they currently apply to what sorts of things you can promote a flavor as, because we're intending to ensure that people were not using names that were immediately and evidently appealing to young people. The issue of actually regulating flavors is fairly complex and challenging for exactly these reasons. And that's why we need to understand where people come down. And, if people have pragmatic ideas about how to address this in a way that serves the balance that we're trying to strike, that provides the sort of protection that we're looking for young people who might be interested versus adults who tell us that flavors were a critical part of their switching, we're all ears. And I do hear both of those messages, by the way, when we get out and survey young people and ask them, what is it about vaping that seemed appealing and made you want to try it? Flavors is definitely one of the things that came up. Flavors, aromas is definitely one of the things that comes up from those young people. But at the same time, I've had numerous pieces of correspondence from individual Canadians who say, please don't take this away. This was a critical part of my success, and I have finally quit smoking for the first time in 25 years. I get these letters.
There's an acknowledgement then from Health Canada that they're important. It's just you're not sure yet what to do with them.
Yeah, they seem to be important in two ways, and it's actually that's sort of the theme throughout this document, is that each of these issues is a two-edged sword, and what we're trying to do is look at the rapidly evolving marketplace here and figure out what the correct stance today is.
Is there the possibility that flavors could be fully restricted in Canada? Or could you say right now that you don't see a manner in which that adult access to flavors would be fully restricted?
At this point, we have people calling for all manner of regulatory intervention on flavors. And I just wouldn't like to try to preclude or to prognosticate on what the minister's going to want to recommend to the government.
So you can't completely rule out a flavor ban?
I'm not ruling out anything.
Let me ask you this. Is the consultation here, the part on flavors, an acknowledgement that what was done in the TVPA isn't enough?
Well, what was done in the TVPA was that a new piece of legislation came in that created this pathway to market for these products and provided the government with a number of what are called regulatory authorities, the ability to make rules that was expressly intended to provide us the ability to respond to a rapidly evolving marketplace. So the TVPA put some core prohibitions directly in the legislation, and in other places left some discretion to the minister and the governor and council to make rules. And that is meant to be fairly nimble. That's why we're moving quickly now on this consultation.
From a regulatory point of view, where your discretionary powers are, it is then within your ability to institute some manner of a full flavor ban. That is something that you can do. It doesn't need to go back to the politicians.
Yes, the Act provides regulatory authority to establish standards for the products that would include what kind of chemistry can be in them, what kind of electronics can be in them. There is a schedule to the Act that can be amended by regulation that prohibits specific ingredients. Right now, that's prohibiting things that sort of make it seem like there's maybe a health benefit, like amino acids or caffeine or taurine or other things you find in energy drinks, but that can be used to preclude any particular substance.
Let me ask you about nicotine concentration. What part of nicotine is of issue here? Just the total amount, or were we also talking about the type of?
That's kind of one of the questions that we put, where there's a section about nicotine and what its role may be. There's fairly good evidence out there that electronic cigarettes are capable of delivering nicotine sufficient to result in symptoms of nicotine dependence. That was the conclusion of the National Academy of Science, Engineering, and Medicine report last year, and it stands. We have this rapidly evolving marketplace with nicotine salts potentiating much higher concentrations of nicotine, or making it palatable to have much higher concentrations of nicotine in vaping products. So it could be some, it could be both. We don't know exactly where people are going to go. This is a place where there's a little less current body of evidence on what we should do. We observe, though, that there are some jurisdictions, like us or the United States, where the level of nicotine in vaping products is not currently restricted, and there are other, like the EU, where it is currently restricted. And so, once again, are seeking perspectives from people and the evidence that they may have available to them to contribute to the decision-making that has to go on here.
Right. And we do hear a lot, actually, the reports that the nicotine salts have played a role with the youth vaping issue, because it does seem to provide that bigger kick that they've been receiving.
Yes, our understanding of that is that the nicotine salts have made it palatable to have much higher concentrations of nicotine. That makes it so that you don't have to inhale as much vape to get a high dose of nicotine. Of course, what kind of dosing you get from using a vaping product is always dependent on your behavior with the product as well as the product itself.
So where we're looking at here is, depending on what the information comes back with regard to nicotine, we could see some kind of a restriction on nicotine salts, and we could see some kind of a restriction on total amount of nicotine.
Yes, that is possible, and that is the question.
I asked you on Wednesday, James, if there were any bad actors. And you kind of looked at me and you went, no, I don't think there's any bad actors. But then when you kind of read this and you go, geez, these pod-based systems here are kind of talked about in this report, in this consultation document. It strikes me that there is a bad actor to the extent that Juul has been singled out so much. And there's one or two other players in the marketplace in Canada, but it's pretty hard not to see that the nicotine salts, the pod-based systems, the stealth vaping issue, so the kind of device, the type of the type of the vapor that's exhaled, these are the kinds of things that point to that there might be one particular kind of device that could be of issue.
We asked about the salts, and we actually asked in a subsequent section about the design of the product and to what extent that may have an impact on the attractiveness of the product for youth, and that can include sort of the size and the length and the width and all this kind of stuff of the product, and whether that sort of stealthiness of a product makes a difference, and whether it makes a difference for adult smokers either. And I wouldn't single out a single company for that. I am aware of at least 5 pod-based systems. There are probably dozens, like 5 that I can think of offhand. There are probably dozens, so yeah, I'm not singling anybody out, but I am interested, or we are interested, in what that sort of design allure is, and whether that is something that should be looked at from the regulatory perspective.
Do you see an irony here with that particular area of the report? Because for so many years, vaping was always associated with the big, huge, obnoxious clouds. And there was quite a bit of disgust over the clouds from the general public, and that was something that vaping always tried to get away from. And then here on the whole other end, you've got the development of devices designed to not provide much cloud at all. But that seems to be a contributing factor to the youth issue.
Certainly when we ask the youth to what extent does the ability that you can do this very discreetly matter, we get an answer from some of them that it matters. What you have here is a very rapidly evolving product category and all kinds of things going on. I don't know if I call that irony. It's rapid evolution. They're all tied together. Those smaller clouds are possible because the higher concentration of nicotine is possible in the cloud. Like, it's all tied together.
James, we didn't really get to it much on Wednesday, and it's not really covered in this report much, is C-stores. How are they entering into this conversation? Because those on the tobacco control side and public health, do single out C-stores quite a bit because of their ubiquity.
One of the things that the minister announced yesterday was some additional effort going on our compliance and enforcement activities over the rest of this year anyway. And we will be visiting a large number of C-stores. We'll also be visiting a large number of vape stores. About 2,000, I think, C-stores and 1,000 vape stores is our target. The idea there being we do need to clearly have a presence in the C-store market and make sure, although C-stores are also well accustomed to being visited by tobacco inspectors to ensure that they're not making sales to minors of tobacco. Vaping stores, many of them have not actually had any contact with health inspectors or tobacco inspectors in the past, and I think it's important to establish a presence with both of them. Our objective is to make sure that nobody is selling vaping products to young people. I think we need to be responsible with all of the retailers.
And on specialty retailers, do you think they are playing a contributing factor to the problem of youth vaping, or are they actually playing a good role?
It's unlikely wise to tar all of a group with one brush. There are likely actors of varying integrities in all areas.
Online sales. All right, we talked about it a bit. According to the data in the report, online sales doesn't seem to be a big portion of the sales going to youth, at least according to the data.
Yeah, that's also, as it points out in the document, that data is not very recent, and this may not be reflective of the current rate of online sales. It kind of doesn't matter very much whether this is 5% or 10% or 20% of the marketplace. It's important that sales not be happening to young people. In the context of bricks and mortar, that's a little simpler because you can ask somebody to produce a driver's license. It's a little more complicated in the online world, and what we're looking at is what measures are people aware of that could help us ensure that there is substantial age verification going on in online sales. And I do understand that can come at a cost for the online retailers, and that may be a factor. But I think it's in all of our interest to try to keep vaping products out of the hands of young people. So that's kind of the point.
Now, the age verification delivery from Canada Post, is that measure robust enough?
Well, in terms of delivering a product to a young person, the Act provides proper age verification as a due diligence defense against having furnished a product to a minor. But the Act does provide regulatory authority, once again, that would enable us to put in place additional parameters around what is required for online age verification or any age verification, what kinds of documents and how. I would point out that particular clause is not yet enforced. It can be brought into force by an order in council, in other words, by a regulation. But we can activate the authority to put in place additional restrictions on what kind of age verification is required.
Is the online aspect of this something that you're looking at in terms of maybe possibly totally getting rid of?
Even within Canada, we have different approaches on that in different provinces and territories. You can see that there's a diversity of ways of going after it. We are interested to understand what people think is really the state of what's possible in terms of responsible, diligent age verification. And sort of one-click are you of age, that doesn't seem like an awful lot of effort from our perspective. I will point out that this is a discussion document. Anything that we do here requires running through the government's regulatory process, which involves another round of consultation at least. So if a regulation is proposed coming out of all of this that goes after one thing or another, a draft of that regulation would be prepared. A comprehensive explanation of why these are the things that are being proposed would be prepared. That's called a regulatory impact assessment statement. That usually includes a cost-benefit analysis, what that regulation is likely to cost to implement and what the benefits are expected are. And all of that, once again, is up for consultation.
So from, say, today to after this consultation closes, how long would it be before we would know what the recommended regulations are? And then following that, how much longer before something would get implemented if that was the case?
Sometimes regulation can move pretty fast. Sometimes it takes a little longer. We do have a federal election looming, so that would probably stop something from happening really, really, really fast. I wouldn't be able to say, though, when exactly it would happen. What happens is the federal apparatus prepares a recommendation for a minister. The minister has to agree and present that to the governor and council, and the governor and council has to agree in order for that to become, before we even move on to the publication in Canada Gazette 1. That's the formal regulation making.
Should Canadians be prepared that they're going to be making this an election issue or not? Because that's the question. And that really is for either side.
That's like far more of a sort of political question than I can really address. All I can tell you is that at this point, Health Canada and the Minister of Health are clearly seized with this issue of youth vaping and are trying to move forward the right kinds of regulatory proposals as quickly as possible.